We are back with Dr. Edgardo Maldonado with Cone Health, Healthy Weight and Wellness. So a lot of people say, okay, what about the fitness part of it? How much physical activity do I need to do?
Well, I think you cannot out exercise a bad diet. That's the first thing. But exercise is definitely a critical component to any weight loss journey, particularly as patient gets to the maintenance phase. So it really does help preserve muscle. Helps protect you against muscle loss, especially with the GLP-1 drugs and when people are losing weight. But it improves insulin level, insulin resistance. People sleep better. They build more stamina. The muscle is like a hub that actually is in charge of systemic health. So it actually influences other organs. Patients also note improvements in stress. They sleep better. They also notice improved appetite control. And what we recommend is people getting about 150 to 300 minutes of moderate aerobic activities. This is like walking, dancing. We also want people to do strengthening 2 to 3 sessions a week. That includes weights, bands, right? Exercises like yoga, Pilates. That's also a form of strengthening. Being more active throughout the day, trying to get about 5,000 to 10,000 steps. But in reality, just start where you are. Even 10 minutes of walking a day counts.
Right, you don't have to go right into 1 hour of working out and running 6 miles. It can start in small increments. All right, let's talk about how important sleep is to weight loss.
So people that get inadequate sleep, right, have problems with increased hunger signals. They also have problems with cravings, and for the most part, they feel tired, right? So they don't have that energy to be able to get involved with physical activity. So sleep is really important.
Okay, let's talk about results, because I think so many people, they start a workout and they're like, I want to see some results really quickly. What is a realistic expectation of seeing some sort of result?
So everybody loses weight right at a different rate. It depends on what you're doing, but what's considered safe and sustainable is 1 to 2 pounds a week. Anytime you try to lose weight quickly, it never really sticks. Again, it's not about the speed; it's about making these sustainable changes that help you maintain that steady progress. That usually gives people that weight loss maintenance.
Cone Health has resources available for people who want to have this healthy weight and wellness journey. Talk a little bit about that program.
Yeah, so the Healthy Weight and Wellness Center, we are a medical weight loss program. So this is a medically supervised program focused on obesity as a chronic disease. Our providers there are board certified in obesity medicine. We also have a medical fitness facility called Sagewell, which they have exercise specialists, they have nutrition, cooking classes. We also have registered dietitians, and we have an excellent group of primary care doctors that are very motivated and to help our patients start their journey.
Okay. And real quick, what kind of advice might you have for people to stay motivated and sticking to that lifestyle change long term?
So kind of focus on your why, right? Celebrate those small accomplishments. Make these lifestyles about you. This has to fit your lifestyle, or else you're not going to be able to stick with it. It sounds like it'll feel like a diet. It will feel burdensome. So this has to be enjoyable and sustainable in order to guarantee long-term success.
And reach out and get some help. You don't have to do everything on your own.
Absolutely not. And Cone Health is here to help you along the way.
All right, we thank you so much for your time and your expertise. If you missed this, maybe you need to send this to a family member or a friend. This is going to be in the To Your Well-Being section of our website.